One of the most shocking truths in women's health is this: up to half of breast cancer cases are first noticed outside the breast, in places most women never think to check. Let that sink in for a moment. The warning signs aren't always a lump. They aren't always painful. And they aren't always where you expect them to be. So imagine this. You see a strange change under your arm, or a bit of swelling near your collarbone, or a subtle shift in the skin on your chest. It looks harmless. It feels harmless. And like most women, you brush it off as irritation, hormones, or something that will disappear on its own. But what if that small, quiet clue was your body trying to get your attention? That's the unsettling reality doctors wish more women understood. Breast cancer doesn't always announce itself. Sometimes it whispers, softly, quietly, in places you'd never think to check. And because those whispers are easy to miss, many women don't notice them until they grow louder, stronger, and harder to ignore. But here's the empowering part. Once you know where those hidden signs can appear, you can spot them early, long before they become a crisis. Stay with me, because in this video, you're about to learn the 5 unexpected places breast cancer can hide and the early clues that could make all the difference. Breast cancer has a reputation for showing up as one thing: a lump. That's the story most women are told. But here's the truth no one emphasizes enough. Breast cancer is far more complex, and its earliest clues can appear in places that don't look or feel like the breast at all. Why? Because breast tissue isn't just the round shape you see in a mirror. It stretches upward toward the collarbone, sideways into the underarm, and deep into the chest. And surrounding all of that is a powerful network of lymph nodes, nerves, and skin, all of which can react long before a lump ever forms. Sometimes cancer cells irritate nerves, creating odd sensations like tingling, burning, or unexplained tenderness. Other times, they affect the lymph nodes, causing subtle swelling that women mistake for weight gain or a puffy day. And in some cases, the earliest signs show up on the skin: slight dimpling, redness, or texture changes that look more like irritation than illness. And here's the tricky part. Most of these changes are painless. They don't feel urgent. They don't feel scary. They feel ignorable, which is exactly why so many women miss them. But when you understand how breast cancer behaves, how it interacts with the tissues and pathways around it, these tiny clues stop looking random. They start looking meaningful. They become signals worth paying attention to, worth mentioning, worth checking before they grow into something louder. Because knowing these patterns isn't about fear. It's about having enough awareness to start a conversation with a healthcare provider sooner. When action is easier, treatment is more effective, and outcomes can change dramatically. This is why looking beyond the breast matters. And in the next sections, you'll see exactly where those hidden signs can show up and what they might be trying to tell you. It often begins with the smallest feeling, something so ordinary you'd never think twice. A tug, a tightness, a shadow of discomfort. And because it isn't in the breast, most women wave it off, chalking it up to posture, stress, or a long week. But breast cancer can be clever, subtle, strategic, sending whispers into places you'd never expect. Imagine standing in front of the mirror one morning, just going through your routine, and you notice it: a faint fullness in the armpit. Not a lump, not exactly. More like your body suddenly feels different on one side. Many women shrug it off as swollen glands or leftover tenderness from shaving. But hidden beneath that simple area lies a major cluster of lymph nodes, the body's early warning system. When something is happening in the breast, this spot reacts first. Quietly, politely, almost hoping you'll notice it. And then there's the collarbone area. Such an odd place to even think about. But sometimes, breast cancer sends its earliest signals upward, not outward. It may show up in the form of a tiny knot under the skin, a strange patch of warmth, or a swelling that looks like nothing more than the result of sleeping funny. Yet doctors know, when the nodes along the collarbone respond, something deeper may be brewing long before a breast lump ever appears. The upper back can also tell a story, one that most women never connect to breast health. A persistent ache that feels annoyingly familiar. The kind of ache you blame on sitting at a desk, carrying kids, or working longer hours than usual. But sometimes, that sensation comes from irritated nerves connected to breast tissue. Not sharp pain, not stabbing pain, just an unexplainable discomfort that doesn't line up with the rest of your life. a discomfort that almost seems misplaced. And then there's the arm. Not the whole arm. Usually just a section, an odd heaviness, a puffiness near the inner arm, or a mild tenderness that has no clear cause. Most women assume it's muscle strain or sleeping on it wrong. But again, the lymphatic system runs like a quiet highway beneath the skin, and when cancer interrupts traffic, the body sends signals in surprising places. Signals we often miss because we don't know how to interpret them. Finally, the nipple zone, the place women do associate with breast changes, but not in the ways that matter most early on. Sometimes it's a shift in direction, a subtle change in shape, a dryness that wasn't there before, or a tingling that feels too random to matter. Other times, the skin around the nipple begins to look slightly different, redder, thicker, or textured in a way that resembles eczema. These changes are easy to blame on bras, weather, hormones, anything but what they could truly represent. What makes all of these areas important is not the dramatic changes. They rarely start dramatic. It's the quiet consistency, the tiny shift that doesn't go away, the feeling that something in your body is trying to get your attention. Not to frighten you, but to guide you. Because doctors don't want women to panic, they want women to notice. They want women to recognize that breast cancer isn't loud at the beginning. It's gentle, subtle, respectful even. It starts with clues sprinkled across the body like breadcrumbs. And the women who listen to those crumbs, who pause, who check, who ask questions early, those are the women who often catch what others miss. In these 5 unexpected places, early warnings can hide in plain sight, not to scare you but to empower you. Because when you know what these signals look like, you stop dismissing them and start protecting your future. Picture this moment with complete honesty. You're going about your day, getting dressed, stretching, maybe catching a glimpse of yourself in the mirror, and something feels off. Not painful, not dramatic, just different enough that your mind pauses. A slight swelling near the armpit, a faint puffiness along the collarbone, a dull ache in the upper back that feels strangely consistent, or a tiny shift around the nipple zone that wasn't there last month. Your brain immediately starts playing tug of war. Should I ignore this? Am I overreacting? Is this nothing or something? This is where you stop, breathe, and choose calm over catastrophizing. The first step isn't fear. The first step is awareness, gentle, grounded, observant awareness. You simply notice what your body is telling you, the same way you'd notice a strange sound in your house, or the way a familiar room suddenly looks a little different. You don't jump to conclusions. You just pay attention. Walk to the mirror and give yourself an extra moment. Look at the area that caught your attention. Touch it lightly. Compare it to the other side of your body. Ask yourself whether this feels new or whether it has been quietly present for a while. Let yourself be curious, not frightened. Let your instincts whisper, not shout. This is when documentation becomes your quiet anchor. Not a medical report, not a detailed journal, just a simple note to yourself about what you noticed, when you noticed it, and how it feels. Because bodies are dynamic, and memories can blur. A small change today can be forgotten tomorrow unless you record it. Writing it down gives you clarity, and clarity is a gift. The next question is the one so many women hesitate to ask. When should I call a healthcare provider? And the answer is far simpler than most people think. You don't need pain to justify concern. You don't need visual proof. You don't need a dramatic symptom. If something feels unusual, persistent, or unexplained, if it simply doesn't feel like you're normal, that alone is enough reason to seek guidance. Calling your doctor is not overreacting. It's not self-diagnosis. It's self-respect. It's choosing answers over uncertainty. When you reach out, you don't need complicated descriptions. You can simply say, I've noticed a change that isn't going away, and I want to get it checked. That single sentence opens a door to reassurance, to clarity, and if necessary, to early detection. And even though most changes turn out to be harmless, caused by hormones, stress, inflammation, or natural variations in tissue, checking in early protects you from the what-ifs that keep women awake at night. More importantly, it reminds you that your voice matters in a medical room. Doctors appreciate patients who advocate for themselves, who trust their instincts, who pay attention instead of brushing things aside. You know your body better than anyone else. You notice the whispers long before anyone else could. So when something feels different, listen. Observe. Reflect. Ask. Not from fear, but from power. Not because you expect the worst, but because you value your health enough to stay one step ahead. This isn't panic. This is protection. This is intention. This is you choosing to respond with strength instead of silence. Because your body speaks softly long before it ever sounds an alarm. And the moment you answer that whisper, you've already taken control of the story. Before you click away, pause for just one more heartbeat, because what you learned today isn't just information. It's power. It's protection. It's the kind of awareness that can change the outcome of someone's future long before they ever realize they needed it. If this opened your eyes, even a little, make sure you stay connected. Hit subscribe so you don't miss any of the life-saving guidance we release. This channel is built to keep you informed, confident, and ahead of the symptoms so many women overlook. And then please share this. Share it with your mother who never complains, your sister who's always busy, your friend who shrugs off every ache, your daughter who thinks she's too young to worry. Share it with the women in your circle who deserve to know that early signs don't always appear where they expect. Because awareness sparks conversation. Conversation sparks action. And action, especially early action, saves lives. A single share could help someone recognize a symptom they might have ignored. A single moment of knowledge could rewrite a woman's entire health story. So pass this forward. Be the reason someone pays attention sooner. And remember, the more women know, the more women survive.